Just in tonight, IBM is pulling out of a key cybersecurity conference in San Francisco this month, blaming fears over the coronavirus. So is the fear justified? University of Michigan psychology professor Josh Ackerman has done a lot of work and research on fear, and he is with us live tonight. Professor Ackerman, welcome. Good to have you with us. I guess one of the tricks is to calibrate fear on the one hand with the realities of a situation. And would you say in this case that the fear has gotten way far ahead of the reality of the risk?
It's a great question. I think it really depends on where we live. In the U.S., I think the risks of infection are probably at this point still pretty low. However, we know that people really tend to latch on to the vivid case studies of these kinds of infections and so forth, really, and ignore the statistics associated with them. It's not unusual. It happens for all sorts of fears. I mean, it turns out that people are much more scared of things like shark attacks than vending machines, despite the fact that people are more likely to die from a vending machine falling on them than a shark attack. So I think it's really difficult sometimes for people to disengage from the fear and really pay attention to those statistics.
What kinds of irrational things does fear lead us to do in the face of, for example, a pandemic outbreak like this? What are the kinds of things that we do that are just driven by fear?
Yeah, so fear has a number of psychological consequences. It has a number of different emotions that it carries with it, including anxiety, when it comes to disease, sometimes disgust. But I would say that research tells us that there's two big consequences of experiencing that fear. One is that it really exaggerates the group boundaries that we see between people, so really pushes people to pay attention to us versus them. And the other is that it leads people to pay attention to the social norms that exist in their group. And really this leads them to care about the people who aren't following those norms. So you put those two things together, and in extreme cases, you can end up with things like xenophobia, ethnocentrism, and other prejudices.
So this would be why, for example, people might be wary of going into Chinatown in New York City or San Francisco, even though there have been no cases in New York City or San Francisco.
Exactly. It's a consequence of the fear and the various other kinds of psychology that people possess around dealing with these kinds of threats, not really the true probabilities of risk.
Professor Ackerman, thank you very much for being with us tonight.